Hello everyone, welcome to 𝘎𝙎 classes English. So I welcome you all to the MCQ series whereby we are going to cover the topic from the dissolution and the diffusion, mainly from our biopharmaceutics. So this topic is all about our revision from the topic as well as learning few new things plus checking your knowledge. So this series, as I always say in my every video, is specifically designed for you all so that you can prepare for the best as well as not even for only for limited to GPAT but NIPER, DI, any other pharmacist exam, you just name it and we have it. So these concepts do form the foundation, the core of your knowledge. So make sure to attempt all the MCQs and try to add your feedbacks and your scorecards into the comment section below. We always check your comments personally and we love the feedback from your end. So please try to add as much possible comment down below. Okay, so that's it for the introduction. Let's move on to our first question of the day. So first question says, fixed law of diffusion can be represented by option number A. We can see, so we have multiple formulas, right? So basically fixed law of diffusion, as the name suggests, diffusion, that means movement from a region of higher concentration to a region of lower concentration. Now this diffusion, if you have heard about, definitely is governed by the fixed law. But even the fixed law has, like, one we have is the steady state diffusion, whereby when the concentration gradient actually does not change with the time, and we have a non-steady one where the concentration gradient actually changes with time and position. So that is how we classify. So basically first or second law of fixed law, all the statements are actually correct. With the passage of time, they may actually change, right? So all the representations are correct for the fixed law of diffusion. Okay, next. Paddle over disc apparatus is used for. Now according to IP and USB, if you remember, according to specifically speaking for USB, we have 7 apparatus. Right now I am writing all the for USB. Please note them down and it will be very helpful in today's video only, right? So we have USB 7 apparatuses. Number 1 dissolution apparatus will be the basket. Number 2 will be the paddle. Third is reciprocating cylinder. Fourth one is paddle over disc. Then cylinder over disc. Then we have, fourth one is actually the flow through cell. Flow through cell. Okay, this is very important. Then paddle over disc. Then cylinder over disc. Then reciprocating holder. So each and every point based on, they can ask you regarding the type of apparatus, the name of the apparatus, or the name, they can ask you the type. For the IP, we have only two, type 1 and type 2. Type 1 is the paddle type and type 2 is the basket type. Okay, so if you just remember these points, you can answer most of the questions today. So paddle over disc apparatus, that is none other than our type 5 USB apparatus. Okay, clear? I think there should not be any doubt about it. Option B here is correct. Next, type 1 dissolution apparatus as per USB, we have seen. As per IP, it is paddle, basket. As per USB, it is basket, then paddle. So definitely option B, basket type, should be the correct answer. I hope the confusion has been resolved. Paddle and the basket, that is in the IP. For the USB, we have basket and then we have the paddle type apparatus. Okay, next question. According to IP, type 1 dissolution apparatus, see, they may confuse you with these, but remember, basket, paddle, that is for USB, type 1, type 2. Paddle and basket are in IP. So according to IP, we have type 1 apparatus, that is the paddle type apparatus. Okay, see, this is that important topic. You can see a lot of questions from here only, right? Hansen paddle apparatus is used for dissolution, disintegration, softening time, melting point. See, everybody knows we can spot our main target, which is the paddle apparatus. Now this Hansen is just a name that has been mentioned to confuse you all, but our prime target must be the paddle apparatus, which is definitely none other than a dissolution apparatus. Okay, correct? There must not be any confusion about it. Option A is correct. Right. Next, Hansen paddle apparatus is used for the dissolution of. Now the dissolution testing, basically the dissolution tests are designed for the oral formulations, right? Oral dosage forms like tablets are there, right? So mainly in the pharmacopoeia, the standard methods are already mentioned, right? So these paddle apparatus are for none other than our tablets. Okay. Okay. Next, dissolution type 4 apparatus. Just now we have seen for the IP we have paddle basket, for the USP we have basket, pedal, reciprocating cylinder, and type 4 will be flow through cell. So type 4 USP apparatus will be flow through cell. Paddle apparatus is actually type 2. Basket is type 1 USP, and then we have reciprocating cylinder type 3. Okay, type 4 is flow through cell apparatus. Okay, that is why I am saying it again and again. So many times the question is asked on this topic. Please try to note it down as much as possible. This is one of the most important from the pharmaceutics. Okay, according to USP, type 2 dissolution apparatus. So USP it is, so we have basket type 1 and then pedal type 2 apparatus. Okay, option number A here is correct. Okay, next, USP type 3 apparatus. We have seen number 1 basket, number 2 paddle, number 3 reciprocating cylinder, right? So paddle over disc is 5th number, flow through cell is type 4, reciprocating cylinder is type 3, and basket is type 1, paddle is type 2. Okay, moving on. Noyes-Whitney equation is employed for. See, we are talking about the most important equation from the biopharmaceutics here. Noyes-Whitney equation actually gives an idea about the drug dissolution, right? It states the rate of the drug dissolution is equal to dAK CS minus CB upon VH, right? So dC upon dt, this is none other than our rate of drug dissolution, that is proportional to the diffusion coefficient into surface area into partition coefficient into difference of concentration in the stagnant layer minus bulk upon volume of the media and the height of the layer, right? Now what is this CS minus CB? Suppose you have your tablet here. So in this case, the first layer that is formed, the tablet here we have. So in the dissolution, we say the first layer that is formed, that because of the tablet that has now started to dissolve in the medium, right? So the first layer that has formed here, that contains high concentration of drug. This contains high concentration of drug, right? So we call this layer as stagnant layer. As compared to what it has the higher concentration of drug as compared to the bulk. So that is why we have stagnant layer and the bulk. In the stagnant layer, the concentration of drug is higher. Then the diffusion starts from a region of higher concentration and more towards a region of lower concentration towards the bulk. So this is described by our Noyes-Whitney equation that gives the phenomena for the drug dissolution process. Okay, option C here is correct. Okay. Moving on, which of the following is used for the evaluation of the dosage form? Number 1 is the dissolution time and of the drug. Number 2 is the elimination half-life. Number 3 is the both A and B, and then uniformity of dosage assay, right? So here actually the elimination half-life is a parameter which is for the pharmacokinetic consideration, right? But this dissolution time, the question is actually incomplete here. The uniformity is also mentioned, right? So I would suggest you all to go through the pharmatech topic, in which you have the official test and the unofficial test for the tablets, right? And as per the multiple dosage forms, we can divide them based on their physicochemical testing, formulation testing, then we have in vitro testing, then we have in vivo testing, in which we have pharmacokinetic testing, biodistribution level studies. So that is actually a broad, but the question here is very much broadly asked for the given question, right? So we'll choose the best here, that is suits the dissolution time. Next, apparatus used to measure the intrinsic dissolution. Now, intrinsic dissolution is actually here the options that are mentioned. Let's read it like in the opposite way. Number one, we have cascade impactor. If you don't know the answer, at least you must remember the cascade impactor is actually used in the case of aerosols. Okay, particle size determination in the case of the aerosol, right? Particle size for the aerosols. Then we have Anderson pipette apparatus. If you remember this, we have studied in the micromeritics under the sedimentation method. Okay, we have seen it in the sedimentation method, right? Next, we have Rose-Miles apparatus. So, Rose-Miles apparatus is another way of the foam height measurement. It measures the foam height. So, definitely we are left with our apparatus that measures the intrinsic dissolution, that is the Wood's apparatus. Okay, I hope the other options are also clear to you all. These kind of questions are actually important because they may ask you regarding a very simple thing but in a complicated way. Okay, so option A here is correct. Next question. The correct order of drug release for absorption from the various dosage form. Before even looking at the options, let's be clear that the drug which is in the solution form, that is actually available, right? It is directly available. So the release is actually nothing, but it is generally administered with a suitable vehicle. So that solution form is actually available. So that will indicate the highest level of the drug absorption, right? Followed by the suspensions, followed by the capsules, followed by the coated tablets. And then we have our other types of, basically tablets are the last ones, and then first we have the solutions. Just the way I selected the solution, the option should be visible to you all that I am talking about none other than the solutions, because they are just administered with a suitable vehicle and the drug is actually available. So we have solutions, then we have suspensions, then we have capsules, then tablets. Okay, last one will be the coated tablet, because that actually is being coated so that it gets into the intestine. Next, Danford model describes. Now we have three models for the dissolution. We have actually three models that describe our dissolution process. So they are asking about number one, which is the Danford model. Note down, we have one film theory. We have one film theory. Okay. Second, we have surface renewal theory. We have surface renewal theory. Now this surface renewal theory is actually known as the Danford model. This surface renewal theory is actually known as the Danford model, right? So basically the funda here is the dissolution that is happening. We have seen a first layer, which is the stagnant layer, is formed, in which the drug concentration is higher and it moves to the bulk, right? But at the concentration is developed, which moves it to the bulk. This is none other than our film theory, which we have talked about. In the case of the surface renewal theory, we generally say that the concept of drug dissolution is actually as soon as the drug is added into the medium, now the dissolution has started, but the drug concentration will move to the bulk because of the small pockets of the solvents that are coming from the bulk and are taking this drug. These solvent pockets are actually filled with the solvent, and these solvent pockets are taking the drug and then taking it to the bulk. So every time a solvent pocket comes, fills the solvent, takes the drug and leave towards the bulk. So every time we have a newer surface here. That is why we say it is a surface renewal theory, right? So two we have discussed. We have dissolution involving the surface renewal. Next question. Which of the following is used to determine the intrinsic dissolution rate? Now, intrinsic dissolution rate is determined by both powdered intrinsic dissolution method or disk intrinsic dissolution method. Now, these are actually very much different based on how you have defined for the USP apparatus and the your based on the Indian pharmacopoeia. So we have powder and a separate disc apparatus for the intrinsic dissolution rate. Okay, we have a separate discussion over this. Next, which of the following is also known as the film theory? Just I have told you we have three. We have our number one, which is the diffusion layer model, which is also known as the film theory. Second, we have 𝙈𝙀𝙍 model, which is the surface renewal theory. Third, we have interfacial barrier model also, right? So, which of the following is known as the film theory? So, none other than our diffusion layer model is referred to as the film theory. Option C here is correct. Okay. Next, in the MDT equation, this mid represents mean integral dose, mid value of drug concentration, time at midpoint between two sampling points or minor dissolution threshold. See, mid in any case, mid is actually any case of the equation is generally represented for the course of the time points, right? So this mid represents none other than our time at the midpoint between two sampling points. Next, MDT is mean dissolution time. Next, which factor is related to the apparatus and test parameter? Apparatus and test parameter. Temperature, definitely it is relevant to the apparatus, that you maintain a suitable temperature, you have heating for that purpose or cooling for that purpose. Agitation or RPM or speed, gently agitation is actually required. Dissolution medium, obviously the type of the dissolution medium actually enhances or reduces the release of the drug from the particular dosage form. So all these three parameters are actually very important. Okay, moving on. Next, the penetration theory of dissolution is also known as, see, number one, film theory or dissolution model is the same. Second, surface renewal theory or 𝙈𝙀𝙍 model, that is the same, right? Now here the penetration theory, actually this penetration theory is none other than other name for the surface renewal theory. Last one we have is the interfacial barrier model. So please note down their names in the slide so that you can remember. These are very important. Okay. Next, which of the following USP apparatus is designed for the controlled dosage form and is known as the reciprocating holder? So the question actually is they are asking about USP. Based on USP, reciprocating holder is which type of apparatus? So remember, basket, pedal, reciprocating cylinder, flow through cell, pedal over disc, cylinder over disc, and reciprocating holder is none other than our last type 7 apparatus. Okay, so that's it for today. I hope you all have got the answers correct. It was a very interesting topic to talk about. And we have a separate theory videos also that are going on. So do check them out and like this video, share with your friends as well as comment down your scores. Thank you so much. We will meet in the next video.